Okay, in the importance of observing how sustainable certification systems evaluate and are implemented, we will talk especially about a project which is the Cardio Infantile Clinic, and we will focus on three systems, which are Will, Living Within Challenge, and Net Zero, to observe the synergy that exists between these and the problems and challenges that could present when implemented. First of all, we have the area of water. For this, we observe that wheel system in the system has important factors to implement, which are based on, for example, evaluate to treatment of inorganic, organic, and agricultural pollutants. This factor is important. As the project it is a clinic, it is vital to regulate the treatment process of the pollutants. For this, the clinic had a good regulatory body in this area, since it is the Director of Operating and Environmental Coordination, which explicitly shares of this field. There is also a synergy that can be observed in both systems, cleaning and water quality checks, which this project applies very well since it's known that drinking water is clean and characterizes quality. In addition, the cleaning of grease, bogs, well and rainwaters and waste tanks is done periodically by hospital engineering. There is the area of air, which is framed by the well system, in which issues such as determine requirements in building that promote claims. Now, another key factor is moisture management. This can be related to its materials of living building challenge certification systems, since there is a synergy between evaluating the material with which the structural elements that make up the building were made in order to evaluate the issue related to the management of such a moisture. Now, having a focus of the project, the clinic stand up for having good sources of ventilation and also through composting. This strategy seeks to reduce the production of plant waste generated in maintenance of gardens through biological decomposition process of compostable mixtures of organic waste through proper controls, aeration, and outdoors. This affecting air quality and can give the creation of mold and microbes. On the other hand, the factor might is evaluate is present in the wheel system, but it can also synergy by the factors happiness of the living building system, since both evaluate issues such as creating environments that optimize mental health and create well-being. Therefore, these two factors of the system are related to the third wish, beauty. This is in the Net Zero certification systems. These have correlations in the consequence to specific they wish to visualize and have designs to elevate our spirit and inspire us to better than we are today. This clinic established a new strategy. This strategy established the degree of risk of zone pressure levels to which employees, patients, users, and visitors are exposed in the environment. Thank you.
Hi, my name is Angie and I'm going to talk about of three elements. First, the energy factor considered one of the most important signs most of the activities to be carried out require it. First, this resource is of vital importance as today's world is ruled by it. Today, there are several types of energy such as electric, solar, renewable, wind, hydraulic, and others. In the case of the hospital, a campaign called Clean Generation or Generación Limpia was carried out, which is an energy-saving strategy that promotes the use of cleaner energy sources and greater energy efficiency. To do this, it seeks to implement strategies to reduce greenhouse gas emissions and the protection and conservation of ecosystems. In the first instance, it should be noted that consumption is measured in kilowatts, that is our electrical energy, consumed per month in terms of number of beds occupied per month and the number of days per month. And the results is approximately 39 kilowatts per bed per day. In this case, we seek to implement the three systems that are Net Zero, Well, and Living Builder Challenge which have this aspect in common. Now I'm going to talk about the health. It is easy to recognize that this is the most important thing in the Fundación Jardín Infantil because it's a hospital. Therefore, it is what most seeks to implement the Living Boulder Challenge and Well system. These two will help to recognize what is necessary for this hospital to find the true point that makes it meet all the requirements to earn the recognition to carry it. First, it should be known that the importance of the health welfare of the workers is quite wide. Okay, considering the above and the systems to be implemented, it can be said that with the help of this, it's possible to reduce or make a change in the use of materials in the personal protective equipment, PPE in English, as for the people who make use of the Fundación Jardín Infantil. It can be said that they are also a priority. The hospital aims for patient safety, quality, and humanization, knowing the importance of supplying clinical care based on high-quality standards, patient and family center, appropriating safe practice in day-to-day performance. Okay, but when we implementing the Living Boulder Challenge system, the topic of nutrition enters, which can be related to it science. It is a branch of medicine. This can be related to sustainable because according to the diets on which specialists are based, they reduce the consumption of certain types of food which are quite harmful to the environment. Therefore, the implementation of this system would be a point in favor, considering that the people usually attend checkups. Thank you.
Okay, good morning. My name is Daniel Rincon. Taking into account beauty, as for its physical appearance, is located in Street 163, number 13B60. It is a strategic place for people who live in the north of the city, since it's not on any main avenue, which makes it not congested both at its routes entry. In addition of that, it has a priority ambulance access, which is very important in the emergency area. It should be noted that the cardio is divided in two areas: the emergency area and clinical care, and the specialist area. They are separated due to their relevance and difficulty when performing surgical procedures. Talking about innovation, the Cardioinfantil Foundation is an innovative institution, especially in its human talent and in its collaborative work, which has allowed it to perform highly complex medical procedures, thanks also to different alliance with the best institutions of the United States and Europe, which it has facilitated access to cutting-edge technology and to have the participation of the most of experienced doctors and scientists. All this coupled with human and compassionate care. Speaking now of comfort, the clinic has green and with human and compassionate care. Speaking now of comfort, the clinic has green and or rest areas where specialists and patients can clear their minds and feel comfortable. The rooms of the ICU, intensive care unit, have beds specialized in follow-up and monitoring of the patient who are there, in addition to the monitoring of the professionals who are making rounds, the sector verifying the status of the patients. The other type of room is known as floor. These are the hospitalization rooms and have a bed, a sofa for visitors, a television, private bathroom, and curtains operated by remote control. In addition do that, it has its respective button to call the manager and or nurse on duty in case of an emergency, or if needed. The hospital has among its principles human care, taking into account the equality. This means that they respect the rights of those who's entered its doors. They work daily to provide a cycle of care and service provision focused on humanized, empathic, compassionate care, individualized, and respect in accordance with the institutional service program and aligned with its strategic objectives. Thank you.
Okay, now we're going to talk about the certificates that would select. The first one is the WELL. The International Well-Being Institute is the one that is in charge to give this. It's a public benefit corporation whose mission is to improve human health and well-being in building and communities. In our case, like it's a clinic, we have a community center. Now, WELL is composed by 7 concepts. The first one is the air. Okay, in the air we can establish requirements in buildings that promote clean air and reduce or minimize the source of indoor air pollution. In this case, we can see that the clinic has this condition, so if they apply for this concept, they will have it because it's important for people health. In the case of water, it promotes safe and clean water through the implementation of proper filtration techniques and regular testing in order for building occupants. Like the before one of the air, it's important to have in a clinic the best water for the people. In this case, we can check that they have the requirement. In terms of nourishment, we can see that it requires the ability of fresh, wholesome foods, limits on healthy ingredients. It is important also and is approved by the clinic because they have to have a specific diet to get healthy. So they must approve this. In terms of light, we say that they have half of the punctuation because it provides guidance that minimize destruction to the body circadian system. And we know that the sunlight is the one that promotes this. And in the case of the of a clinic, it's probable that they will not have sunlight enough. So in this case, we select that. In terms of fitness, we say that they don't classify the concept because it's a way to get healthy people, but making like exercise, something that is with a specific equipment. So in this case, we can say that they will have to have this equipment because they have to give like a resource for the people. In case of comfort, of course, a clinic must have the best equipments that they can. So we said that they have this concept. And in terms of mind, because it's a clinic, is of course that the part that is physical and mental has an important part for the healthy part, specific the clinic. And now we're going. These are three. There are 3 classifications. It's a process of 5 steps. The first step is registration. The second step is documentation requirements, performance verification, certification, and if you want to improve, you can get a certification, but you must pass the process again. Then we have net zero. In this case, it's very easy to understand because the only requirement that they have is to get the same renewable energy is equal to consumption. It means that the energy that they waste, they produce. So to get this, they must have absolutely zero.
On the other hand, as mentioned above, it has the living building challenge